Well, this month we're focusing our attention on Hawaii's healthcare situation, a crisis of numbers, a crisis of care, and a crisis that could impact you and your family. The west side of the Big Island of Hawaii is a microcosm of the crisis, with specialists there in short supply. KHNL News 8's Leland Kim tonight explains the continuing problems of recruiting and then retaining top medical talent.
So how long have you been sick? Here,
About 2 weeks, actually.
Orpheus Dillard is a patient at Kona Community Hospital. He's noticed a shrinking population of doctors on the Kona side.
It's going to be a major crunch. I mean, I think people are really going to suffer. We may have a lot of our population leave because of that.
Surgeons like Dr. Larry Peebles say the problem is Hawaii has one of the lowest reimbursement rates in the country.
If I'm expected to go do some work and I'm being paid at a rate that doesn't cover my costs, I'll stop offering that service.
That means patients have to go off-island for complicated, potentially life-threatening illnesses.
If you look at the statistics on the island of Hawaii, we're in the state, we're the worst in strokes and cardiac care in terms of final results. And the reason that is because there's delays in treatment.
The high cost of malpractice insurance is also driving doctors away. It's about $150,000 just to defend the lawsuit.
So every time someone sues a physician, whether they win or lose, it costs $150,000, which comes out of my overhead, which of course bounces back down to the patient.
So the Kona side is underserved, especially with specialty care. In January, Dr. John Bellotti was the only orthopedic surgeon taking calls in Kona. Just last week, another began practicing there.
Any 1 month could seem like the gun lap in a race. You could go faster and faster and faster, but then you have another month and another month and another year.
He and others advocate medical liability reform similar to measures that transformed healthcare in Texas. Before voters there passed a tort reform law in 2003, 9 orthopedic surgeons closed their practices over 3 years. Since then, Texas saw a dramatic jump in the number of orthopedic surgeons, attracting more than 100 in just 2 years. Doctors say something similar could work in Hawaii, but patients must get involved.
When the patients stand up and let the legislature know that they will vote them out if they don't take action, then I think there'll be action.
So unless something changes, doctors say patients will continue using the ER as a doctor's office. In Kealakekua, Big Island, Leland Kim, KHNL News 8.
Now, Hawaii lawmakers are considering medical liability reform this session, and next week we take a closer look at the Hawaii Medical Service Association, better known as HMSA. Critics, and you just heard one of them, have blamed that organization for poor reimbursement rates to doctors. We give HMSA executives an opportunity to respond.